Hello, and thank you for joining us for this interview between Dr. Costa and Linda Moss. The goal of the patient journey is to capture and understand the experiences of those who have been impacted by wounds. When Linda shares her story, you will learn about her experiences as a daughter whose father suffered from a severe pressure ulcer after being hospitalized. If you would like to learn more or participate in this project, please reach out to one of the emails listed below.
Very important. You already talk a little bit about the message for healthcare providers and understanding this context now where we see that families are not always welcome to ask questions because also due to we need to understand how our is rooted. It is rooted on a paternalist model and where healthcare providers know everything. They are there, they will take care of everything. They don't accept help because they are paternalist, okay? Yeah. So this is probably the way most of healthcare providers were trained and socialized. But now with these trends of family partner as a partner, yeah, healthcare provider and patient as a collaboration, shared decision making, all of these, how do you think we could work to improve our healthcare system to shift from paternalism to a more collaborative care approach where we can engage family and families?
No, absolutely. And I think, the medical teams are responsible for their patients, and, there's liabilities and all of that stuff. So, there's certain expectations that I think the medical teams need to make clear with the families that, okay, you're here, our job is this, and your job can be this, and this is where you can help me with your loved one. We don't want them touching machinery and pressing buttons and doing all that stuff. That's where we're not educated enough, and we're not experts. And I'm not an expert by any means. And I would never touch anything, any buttons or anything like that. But I think the biggest thing that families can do is just be there for them emotionally. So, there's the commercial of the Ronald McDonald House that goes around where it says family is medicine. It's very true. You need both. You need the medical teams to do their thing and make sure the right medications are going in. But also, one of the things that we discovered was our dad's nutritional feed was changed 2 weeks before he was transferred back to Hospital 1. So if this was developed earlier, I think it could have made a difference because he was really getting skinny and they changed it to be more protein. And he was also diabetic. So we may not understand a lot of the medical things that they do, but we need to be told it so we could kind of understand this and know what's happening with our loved one. So, we're smarter than what they think, and give us the opportunity to learn and to know more, and talk to us while you're caring for the patients. Talk to us and tell us what you're doing. And, if it's something that you can't really talk about and it goes to the doctor, then help us recite that question that we can ask and make sure that, we're all on the same page.